is a human right.
Healthcare is a human right.
That's why today we stand and fight. Healthcare is a human right. That's why today we stand and fight. Oh, 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 oh. Hospital closures got to go. Oh, oh, oh. Hospital closures got to go. Healthcare is a human right. That's why today we stand and fight. Healthcare is a human right. That's why today we stand and fight. And oh, hospital closures got to go. Come on, y'all. Oh, oh, oh. Hospital closures gotta go. Health insurance is a lie. They don't care if people die. Health insurance is a lie. They don't care if we die. Oh, 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 oh. Profiteers have got to go. Oh, oh, oh. Profiteers have got to go. Ain't no way we're backing down. We're rising up, the time is now. Come on, clap your hands. There ain't no way we're backing down. We're rising up, the time is now. So neighbor, neighbor, can't you see? Well, healthcare is what we need. So neighbor, neighbor, can't you see? That healthcare is what we need. Forward together. Forward together. Forward together.
Buenas tardes, welcome everyone. We are so glad to have you here. And we are tonight doing this event in English and Spanish. So I want to invite Charito to explain how our interpretation will work.
Muchas gracias a todos los que hablan español. Bienvenidos porque este es un programa bilingüe. Y lo que vamos a hacer es que les vamos a pedir que en un momento dado, la parte de abajo encuentren un globo que dice abajo interpretación. Y entonces ese globo, cuando ustedes pulsan ahí, les va a dar la opción de estar en inglés o en español. Les pedimos que marquen el español para entonces poder escucharme a mí traduciendo al español todo lo que se dice en inglés. Muchas gracias.
Muchas gracias. Thank you, Charito. And for those of us who would prefer English tonight, we also should select that option in Zoom. So you should see a globe at the bottom of your screen that says interpretation, and you can choose either English or Spanish. There will be some Spanish translated to English, so it's important you select that option if you would like to hear the translation into English. My name is Reverend Wes McNeil. I'm the Executive Director of the Labor Religion Coalition and one of the tri-chairs of the New York State Poor People's Campaign, and we are so excited that you have joined us tonight for this event and looking forward to digging into this really critical issue facing our state and our country as we struggle for the right to health. We know that is a right that we all are entitled to, but that we have to engage and struggle to make it real. I am going to turn it over now to my friend, the Reverend Chris Wiley, to start us off with a poem.
Thank you, Weston. Thank you, everybody.
Gracias, Weston. Gracias a todos. I need to be an interpreter, please.
I'm Reverend Chris Wiley. I wrote this poem as a reflection, thinking about coming out of a arts and culture poor people's campaign meeting. Somebody mentioned the book, That Bird Has My Wings, the story of an innocent man on death row by Jarvis Masters, and also the words from Reverend Dr. Martin Luther King, that we won't remember the words of our enemies, but the silence of our friends. So as I was reflecting on those and some of my own work and the pushback that I receive, especially around healthcare and especially around the push to be included and the inclusiveness that we all need, I wrote this poem, and I'm going to share that with you now. Sometimes my life feels inconsequential, maybe because our friendship's so coincidental, brought together by a horrible virus that's changed our lives, that should unite us, just as it did in so many ways, as we sat inside for so many days and days and days and days. It made our world seem very small, a place where each and all could join together, whether by laptop, computer, or call. Pop on screen, what's up, y'all? What good can we conjure for those whose margined lives have been disregarded, sold to corporate interest bargains? That's why I joined the movement. I saw a need for vast improvement. Moving along, I started smoothing paths so others could be included. But what about me? What if when all this goes away, when in our houses we won't stay? I see it now while numbers escalate. I've heard it asked, Chris, ain't this wrong? Would you really burn it till it's gone? Why these lyrics in your songs? Do you need to really come on so very strong? So I'll tell you, what if when you move along, left behind as you move on, slow at first, but not for long, I sing words of one in pain, of one left out trying to say, see me, hear me, know me, love me enough to facilitate change, so my dreams don't seem so far away. Instead, I'm blocked by stairs and stairs. Ultimately, I'm left to ask, is there anyone who cares? That's just it now, don't you see? I live in this world not built for me. Even if it's safe, I still scream. Left out, alone. What's worse, forgotten or unknown? Think about all those places with steps, not ramps, never mind your stages. I'm left down here to sit on the floor, if I can even get in the door. Think about what makes me bring my fire, what things I've seen to draw such ire, belonging my only real desire. So mask up, stay home, do all those things, because liberation are these words I sing like Jarvis Masters. Only you have control over my wings. On my own, I cannot mend. I need you now to join in. To think of me, I'll ask again, like Martin said, you need your friends. In silence, all this never ends. So please, don't forget me. I'm here outside. Just bring me in. Thank you. I'll turn it over now to Jeff, who will give an intro of the Truth Commission project in this event.
Greetings, everybody. Can everybody hear me okay? Excellent. Thank you very much, Chris. That was beautiful. Thank you. I'm going to read my own statement here. My name is Jeff Monroe. I live in Mount Vernon, New York, Westchester County, and I'd like to share my own perspective on the failures of our current profit-driven healthcare system. A recent injury forced me to use our local emergency room at Mount Vernon Hospital, run by Montefiore Health Group. The inadequate services I experienced over 5 years ago have only declined, and in following years, and until recently, Montefiore has even threatened to close the hospital because their profits there are allegedly insufficient. While they continue to degrade services and underserve a mostly Black community, our for-profit health system still rewards those corporations and their investors as people who need their help the most continue to suffer. I stand with the New York State Poor People's Campaign Jubilee platform, which is to protect and secure health care for all, expand our public healthcare infrastructure and capacity, and to end medical debt. Thank you all for listening.
Very good. Folks can see Jeff briefly there. Jeff, you had your video off for a second, but I think your face popped in. All right, thank you for sharing those comments to get us started. Hey everyone, my name is the Reverend Joe Paparone. I'm the lead organizer with the Labor Religion Coalition of New York State. And I want to just share a little bit about this Truth Commission project overall and why we're focusing on healthcare today. 5 years ago, 2017, the Labor Religion Coalition launched the our initial Truth Commission project. And we held 3 hearings around New York State. And the goal was to connect poor, dispossessed, working class people from every area of struggle, to share their stories, to identify commonalities, to bring people together, to set the stage, really begin planting the seeds for a broad-based movement of the poor and dispossessed. And we did this in anticipation of the launch of the Poor People's Campaign in 2018. And at the time, we had 3 events, one in Western New York, south of Buffalo, one in Schenectady, one in Long Island. We heard from over 80 testifiers. You can find, someone just dropped in the chat, you can find some of the background and reports there. And now 5 years on with the Poor People's Campaign going strong in over 40 states around this country, we thought it would be a good idea to revisit this process of hearing from those most directly impacted by these crises. And so back in October, we held another Truth Commission with our friends in the Shinnecock Nation of Long Island, learning about Indigenous issues and struggles. In December, we heard from folks in the Capital Region, partnering with a few church and food distribution groups around food insecurity and housing issues. And today, we're here to talk about the right to health and the third Reconstruction. Now, these Truth Commissions are not simply venues for folks to share their sad stories, right? We really want to elevate and frame these narratives in an important way. A mentor of many of us, Willie Baptist, has shared with us that movements begin with the telling of untold stories. And so it's important that we hear these stories, but oftentimes the struggles of the poor and dispossessed are presented in this sort of, oh, woe is them, there but for the grace of God go we, this very condescending sort of attitude. And we reject that. We want to look at things through a lens of the plight, the fight, and the insight of the poor and dispossessed. So yes, we absolutely need to hear the stories and narratives of struggle and the ways that people are suffering under our present system. But we also need to hear the ways that poor, working class, dispossessed people are organizing to fight back and to confront these systems. And then further, the insight, which is a critical piece, is to reject that condescension and sort of charity mindset, is that poor and working class people know what we need. We know the solutions to these problems. We know that they are systemic and structural, right? And we reject the lie that people are struggling just because they made a series of individual choices that led them to their circumstances. We recognize that the crisis of healthcare in our state and in our country, and frankly around the world, is a result of systems and structures. And it's going to take an organized mass of people coming together across lines of division to change those systems and structures. So I want to share briefly just a few key points about the state of healthcare in New York State. And this is important because some of our elected leaders have been almost bragging about how advanced New York is in providing coverage, in reaching everyone in the state with some degree of healthcare. And while it may be true that if we compared ourselves to every other state, we might rank in certain metrics pretty well, we know that that's not enough. And we know that that's not enough because 1 million New Yorkers lack health insurance and millions more are underinsured. And insurance, we just know, is not enough. On average, 50% of New Yorkers with health insurance still struggle to access healthcare due to cost, insurer-imposed barriers, lack of access to services, depending on where you live in the state. Medical debt is a leading cause of personal bankruptcy in New York. And in the first 9 months of the pandemic, 55 of New York's nonprofit hospitals sued nearly 4,000 New Yorkers for medical debt. National studies have found that at least 1 in 3 COVID deaths and 40% of COVID infections were tied to lack of adequate insurance. And in the first months of the pandemic, fatality rates among Black and Hispanic New Yorkers were more than double that of whites due to higher risks of exposure and due to higher rates of chronic health conditions that amplify the fatal impact of the virus. It's important for us to acknowledge the system of white supremacy that all of the things are, everything we encounter is built on, everything in our society is built on, and that these crises don't affect everyone equally, but they do impact us all. 1 million New Yorkers, right, who either lack health insurance and millions more who are underinsured. That crosses lines of race, lines of geography, any other line of division that the ruling class likes to throw at us to keep us from coming together in the ways that we need. There's also been some confusing narratives about our healthcare system in these past few years of the pandemic. At the very beginning of the pandemic, you may recall that our healthcare workers were lauded as essential workers, pots and pans in the street, endless press conferences from our elected leaders just raving about the bravery and the courage, all of which is absolutely true. And yet then the systems do not provide the necessary resources, the necessary personal protective equipment, the necessary supports so that our healthcare professionals, the people who provide these absolutely essential necessary services can be supported, can survive on their own even, let alone care for the people amidst the pandemic. Right, so there's this contradiction in the ways that we laud essential workers, but then our systems and structures don't support them appropriately. And that is all rooted in this profit-driven narrative. The fact that although many of us, I hope all of us, believe that healthcare is a human right, it is treated as something to be to make money off of by insurance companies, hospital associations, pharmaceutical companies, right? It is a way to extract wealth and actually limit care for poor and working class people. The ways people are trying to respond and meet the needs around our state and our country have been remarkable and impressive, right? Mutual aid, local community networks to support one another, to make sure that people have the things that they need to survive. And that's important work that we want to elevate, but we know more is needed. We know that mutual aid networks in any locality are not going to be enough to take on this system, to transform this fundamentally unjust system of healthcare for profit. And so while we acknowledge that and elevate those things and want to work in those kinds of mutual aid networks and support one another, we want to understand them as projects of survival, as ways that we can come together to meet immediate needs so that we can build the kind of movement necessary to change this fundamentally unjust system. So all that said, I just want to provide some context and overview of the Truth Commissions and this crisis of healthcare. And now I'm going to pass it to my good friend, Ursula Rosum, to introduce some of our testifiers.
Good evening, everyone. Thank you so much, Joe, for your words. I'm one of the co-directors for Campaign for New York Health. We are a statewide coalition dedicated to winning the right to healthcare in New York by passing the New York Health Act. And we believe that in order to do that, we need to build a broad, deep movement led by those who have been most impacted by the failures and shortcomings of the existing healthcare system, because that's really who knows what is needed in order to make healthcare as a right a reality. And now we're going to move into really the heart of the program tonight and hear from New Yorkers who will speak to what it's really like on the front lines of our healthcare system today. And the first speaker will be Vernetta Urkhart, a registered nurse at Mount Vernon Hospital and a member of the New York State Nurses Association. Vernetta, are you able to unmute yourself and turn on your video?
The host stopped it.
The host stopped it.
You can't hear you.
Can't hear.
We can hear you now, Vernetta.
Okay, can you hear me now?
Yes,
Video.
can you turn on your video so we can see you as well?
Yes,
It says
it's not allowing me.
It says, okay. Let's see.
Okay, we're good. Yeah. Hello, good evening, everyone. Good evening. Hi. My name is Vernetta Urkhart. I'm a registered nurse. I work at Mount Vernon Hospital for 31 years. I work the night shift on the medical surgical floor, but I also work the ER. I'm often flown to the ER to work there. I'm also a resident of Mount Vernon, an active member of the NYSNA and the community of Mount Vernon. When I started to work at Mount Vernon, it was a full service hospital with labor and delivery, oncology, cardiology units, pediatric unit, and several medical surgical units. Mount Vernon also had an excellent school of nursing. My daughter is also a graduate from that Mount Vernon School of Nursing. Nostalgia takes me back to the time of that evening before my husband and I took our daughter home. We were given lobster and champagne dinner right there at Mount Vernon Hospital. Bon appetit. Those were the days. One of the things that I love about working at a small community hospital is that I get to know my patients. Over the years, I have developed relationship with so many patients who have come to look for us to help. And that is why we, the nurses and the other healthcare workers are, and that is what we, the nurses and the other healthcare workers are trying to do at Mount Vernon Hospital. We are trying to help patients in this community, but it is really hard to do so with the reduction in services. We are doing the best that we can with the little that we have. We have very little to work with at Mount Vernon Hospital now, and that is by design. I tell you this story. About months back or so, due to short staffing and reduction in service, I was the only nurse that was working on that medical surgical floor that night with several COVID patients. I was accompanied by a tech. And at 5:30 a.m., while doing AM care on a patient, the patient stated, "Nurse, I don't feel that well. I feel nauseous." And, I stopped the care, about to take the vital. She said, nurse, I feel very nauseous. Did the vital sign, call the doctor. The doctor was there right away. By the time the doctor came, begin to check the patient out, all of a sudden, the patient started gasping. We activated the code. A nurse that belongs to recovery, she was coming that morning, she ran to help. Okay, 2 nurses from ER came up to help me. And then we had to call the doctor, the only doctor that's in ER, to come to that floor and help with the intubation. So the patient was intubated. After the patient was intubated, respirator and everyone came. Everybody know how vital, it's like a war zone. We have very little help, but we do the best that we can to give the best possible care to each patient, because the patient deserves it. The patient did not ask to be in the situation that they're in, and it's our job to do the very best for them. So to make a long story short, the patient had to be taken from a medical surgical floor, not to ICU. The patient had to go to ER and wait there after the intubation for service or ambulance to come, and after the paperwork was done, and take that patient to Montefiore Moses, 30 minutes away or more, depends on traffic, to get help. I leave the patient in the ER in room 7 after I register at the register for that location. They could trail where that patient was by the computer from 5 to ER, blah. Anyway, so to make a long story short, I left there not knowing what happened to the patient after, because by HIPAA, I cannot know. Okay, going with my statement. Our brother, Dr. Philip Oswald. I'll use his name interchangeably. When I say Montefiore, I mean Dr. Oswald, and vice versa, because he's the face of Montefiore. He's the umbrella organization of care. He's the one that says who or what community get care. And this care that they're giving out, only a certain amount of people will get that service, as what we're looking at. The people that are underserved is not deserving, since their insurance does not qualify for that. Okay. No one from Montefiore bothered. Okay, Dr. Oswald was given the task to shut down our community hospital. No one from Montefiore bothered to inform the community people about their plans to close the well-needed hospital. Listen to this. 70,000 people live in Mount Vernon in zip code 10550. 65% are Black, 20% is white, 16% is Latina. Listen to this again. In White Plains, 58,000 people live in White Plains. 60% are white, 11% is Black, 30% is Latino. White Plains get to keep their hospital with a low number of people, while Dr. Oswald want to close Mount Vernon Hospital and keep White Plains Hospital open. He's grabbing and destroying the heartbeat of Mount Vernon and killing the dreams of a thriving city. A city that is plagued with so many comorbidities. Heart disease, we got it. High blood pressure, we got it. Respiratory disease, we got it. Cardiovascular disease, we got it. Joint disease, we got it. Mental disease, we got it. Diabetes, you name it, we got it in the underserved community of Mount Vernon. But only if we had equity instead of disparities, health disparities, economical disparities, and racial disparity, Mount Vernon would still have a full service hospital like the way it was. And I remember vividly how it was. It is still baffling to me that Dr. Oswald closed the ICU in the middle of a COVID pandemic. We know that Montefiore, Dr. Oswald, has planned to close Mount Vernon Hospital. And such a plan is profit guided, misguided, and will harm this already underserved community. Mount Vernon is a majority Black city, and it is not only dangerous for the ICU to be closed by Dr. Oswald, it's also racist. I have read that novel, Uncle Tom Cabin. Did I say more? Montefiore plan to close Mount Vernon is not a done deal. Hear me today when I said, Vernetta Urkhart said, Montefiore planning to close Mount Vernon is not a done deal. Monty doesn't have this CO and abbreviated, meaning certificate of need. Montefiore don't have the DOH, Department of Health approval, and Montefiore doesn't have the new governor's approval to close the hospital. Montefiore, the mothership, will also have to come through Mount Vernon City Council, where abbreviation SPH, as Sean Patterson Howard, campaigned on the promise of October 24th, 2019 to fight alongside the City Council and the people of Mount Vernon to not allow Montefiore to close our hospital. Truth is, history won't care about our long stride today or tomorrow if we lose sight of our neighbors suffering, deafen our ears to the cries for help, or turn a blind eye to the death and tragedy. Dr. Ho, every trailblazer should want to leave a legacy of hope, inspiration, empathy, care, and compassion to inspire the world and a new generation every time. Every patient deserves quality care, regardless of their zip code. That is so true. That's the God-given truth. Instead of investing in Mount Vernon, as they did in White Plains, and instead of improving services, they eliminated services. The nurses and the community are demanding answers. We are demanding equitable and equal care for Mount Vernon people. It is truly baffling and maddening to me to know that a person like Dr. Oswald, who stated that he had experienced racism, now boldly holds up the mantle of exclusion. This mantle of exclusion was designed to phase out an already underserved community like our beloved city of Mount Vernon. We, the people of Mount Vernon, and their leaders are requesting that Dr. Oswald do the right things for our community and their people. NYSNA keep fighting and fought to open ways through coalition that we have formed to save and transform Mount Vernon. NYSNA is able to join force with concerned community leaders clergy, labor, and elected officials to fight against closure of the hospital. We don't trust Dr. Oswald to do the right thing for Mount Vernon. Thank you very much. Forward together, not one step
One
back.
step back. Thank you so much, Vernetta, for your testimony, and to the New York State Nurses Association for their leadership in the fight for patients' rights and for health justice in communities around New York State. Thank you so much, Vernetta.
Amen, amen.
Next, we will be hearing from Olga Vasquez, a member leader from Make the Road, New York. And please, if you are an English speaker that does not speak Spanish, please be sure to turn on the interpretation function. You can do so by going to the bottom of your Zoom screen and clicking the globe that says interpretation and choosing English. And now, Olga, le damos la bienvenida.
Hola, buenas noches.
Buenas noches. ¿Puede prender su cámara?
No me deja el host.
Ok, adelante.
The host me dice que no puedo entrar en video.
Can someone help and turn on Olga's camera? Maybe the Zoom host?
Ask to start video. There we go.
Yeah.
Yeah.
Gracias. Hola y buenas noches. Mi nombre es Olga Vázquez y soy miembro de Make the Road, New York. Realmente creo que la atención médica es un derecho humano. Los miembros de mi comunidad luchan por acceder a los servicios de atención médica y como resultado terminan sacrificando su salud. Cientos de miles como yo no pueden inscribirse en un seguro de salud debido a su estatus migratorio. Contribuimos a la economía y pagamos impuestos, pero se nos niegan los derechos básicos. Necesitamos aprobar.
I'm sorry. Can we just, we need to pause one moment. I think there's something confused about the audio channels. Olga, can you make sure you're on the Spanish channel?
Olga, Olga sabe asegurar que está en el canal de español porque no pueden escucharle los intérpretes.
Okay. ¿Quiere que repita de nuevo? Ok, ¿me escuchan? ¿Me puede escuchar el intérprete?
Yes, that's better. I think it sounded like you were talking over each other before.
Okay. So, mil disculpas. Hola y buenas noches. Mi nombre es Olga Vázquez y soy miembro de Make the Road Action en Nueva York. De Make the Road, New York. Realmente creo que la atención médica es un derecho humano. Los miembros de mi comunidad luchan por acceder a los servicios de atención médica y como resultado terminan sacrificando su salud. Cientos de miles como yo no pueden inscribirse en un seguro de salud debido a su estatus migratorio. Contribuimos a la economía y pagamos impuestos, pero se nos niegan derechos básicos. Necesitamos aprobar Coverage for All y ampliar el acceso al seguro médico a los inmigrantes neoyorquinos de bajos ingresos, que actualmente son excluidos debido a su estatus migratorio. En enero tuve un accidente donde me caí y me rompí el tobillo. No tengo seguro de salud para proporcionar la atención, los medicamentos y las terapias esenciales. Entre el alta del hospital, después de la cirugía y mi día de seguimiento, me quedé sin analgésicos y terminé de nuevo en la sala de emergencias. Incluso no pude obtener una receta. En cambio, me recetaron hierro por error. Fueron días insoportables. Mi recuperación requerirá meses de terapia, al menos 3 por semana, que necesitaba comenzar de inmediato. Sin embargo, no tenía los ingresos para pagar la terapia y ahora estoy viviendo con los efectos de la demora. Mi primer sesión costaría $400 y cada otra sesión costaría $100 cada una. El total costaría al menos $300 semanales. Durante los próximos 4 meses, retrasé el inicio de la terapia debido al costo y pasé tiempo buscando centros de salud alternativos a un costo más bajo. Como resultado de todas mis necesidades de atención médica, no pude volver a trabajar cuidando niños. Mi salud debe ser tratada como un derecho y no como un privilegio. Los servicios de prevención, urgencia y emergencia son vitales para nuestra salud. Por ejemplo, he pasado meses tratando de programar una cita para una mamografía. Este servicio es considerado preventivo para la mujer, además de análisis de cáncer de cuello uterino, entre otros. Si tuviera un seguro médico, este servicio sería gratuito. Sin embargo, me cuesta cientos de dólares que me resultan difíciles de pagar. Pero mi experiencia no es única. Miles de neoyorquinos como yo sufrimos en silencio por la falta de atención médica, acceso a medicamentos y análisis de laboratorio, esenciales para nuestra salud. Estoy aquí para decir basta. Fuera la injusticia y adentro con cobertura para todos. El tiempo es ahora. Los legisladores deben incluir Coverage for All a los proyectos de ley de una cámara y debe incluirse el presupuesto estatal este año. Con solo $345 millones, miles de personas excluidas finalmente pueden convertirse en beneficiarios de un seguro médico de salud. Gracias.
Gracias, Olga. Gracias, Olga, por compartir su testimonio. Thank you, Olga, for sharing your story.
Ursula, I want to interrupt a moment because my apologies to everyone. We had some audio issues, so I don't know if you were on the English channel, that was difficult to understand. I know our folks were doing their best, and then that further extends to our folks who are doing ASL interpretation. But we don't want to, I want to make sure that Olga's testimony gets shared appropriately and clearly to everyone. Sometimes in our movements, we like to say that we move at the speed of liberation. And so sometimes it takes a little longer, but I wanted to ask, we actually do have at least a loosely translated version of Olga's testimony. Ursula, if you have that up, would you mind reading that and basically resharing Olga's testimony? And again, apologies to folks and apologies to Olga. We're sorry that it wasn't being as communicated as clearly as possible, but we want to make sure that this critical testimony gets shared appropriately. Is that okay, Ursula? Or
yes, I have it in front of me and can read.
Thank you.
So what I'm reading is the prepared testimony from Olga Vasquez of Make the Road. I truly believe that healthcare is a human right. Members of my community are struggling to access healthcare services and end up sacrificing their health as a result. Hundreds of thousands like me are barred from enrolling into health insurance due to immigration status. We contribute towards the economy and pay taxes, yet we are denied basic rights. We need to pass coverage for all and expand health insurance access to low-income immigrant New Yorkers who are otherwise excluded due to their immigration status. In January, I had an accident where I fell and broke my ankle. I do not have health insurance to provide the essential care, medications, and therapy. In between the hospital discharge, after surgery, and my follow-up visit, I ran out of pain medication and ended up back in the emergency room. I wasn't able to get a prescription and instead was wrongfully prescribed iron. It was an unbearable few days. My recovery will require months of therapy, at least 3 a week, which I needed to start immediately. However, I did not have the income to afford the therapy, and now I am living with the effects of the delay. My first session would cost $400, and every other session costs $100 each. The total would cost at least $300 weekly for the next 4 months. I delayed starting therapy due to the cost and spent a long time searching alternative health centers for a lower cost. As a result of my healthcare needs, I was unable to return to my work taking care of children. My health should be treated as a right and not as a privilege. Prevent, urgent, and emergency services are vital to our health. For example, I have spent months trying to set up an appointment for a mammogram. This service is considered preventative for women, in addition to screening for cervical cancer, among others. If I had had health insurance, this service would be free. However, this cost me hundreds of dollars, which I find very difficult to pay. My experience is not unique. Thousands of New Yorkers like me suffer in silence due to the lack of medical care, access to medication, and essential lab work for our health. I'm here to say enough. Out with injustice and in with coverage for all. The time is now. Legislators need to include coverage for all in the one House budget bills, and it needs to be included in the state budget this year. With only $345 million, thousands of excluded people can finally become beneficiaries of health insurance. That was testimony prepared by Olga Vasquez of Make the Road, New York. Next, we will hear from Gemma Kalinda, who is the Hudson Valley organizer with Hand in Hand in the New York Caring Majority. Welcome, Gemma.
Hi, how are you?
Good,
All
good to
right.
see you.
Good to see you too. Thank you so much. Okay, hello everyone. How are you doing? My name is Gemma Kalinda and I'm the Hudson Valley organizer for Hand in Hand and the New York Caring Majority. I'm going to tell you about Fair Pay for Home Care Act. This campaign is near and dear to my heart because I was diagnosed with multiple sclerosis as a young teenager. And 9 years ago, I started using a wheelchair because I was unable to walk. And 3 years ago, I began to search to find a home care worker because I desperately needed help with my simple daily routine. Not so simple anymore. I'm not going to go into details, but trust me when I tell you, it was an extremely difficult task that no one should have to go through just to receive care. A big reason why it is so hard to find home care workers, is because home care workers only make $13.20 an hour in most parts of New York State, doing crucial work and incredibly important work, keeping people with disabilities and older adult New Yorkers out of nursing homes in our own and being able to remain in our own homes and communities. The Fair Pay for Home Care campaign would address the home care workforce issue by making home care jobs living wage jobs in New York State. If included in this year's New York State budget, it would increase the wages of home care workers to 150% of the highest minimum wage, which would raise the average income from $13.20 an hour in most parts of New York State, like I said it is, to $22.50 an hour. What a serious increase. Here are some of the reasons why fair pay for home care is needed for all New Yorkers who need care or will need care in the future. Because although many of us don't want to admit it, over 70% of the population will need some form of long-term care at some point in our lives. The vast majority of people don't want to go to a nursing home. They want to remain in their home. Now, New York's population is aging rapidly, and the state is facing an urgent crisis. We don't have enough home care workers to care for older adults and people with disabilities. In fact, New York currently faces the worst home care shortage in the entire nation. In a recent survey, 25% of home care patients reported that they were unable to find home care workers, and nearly 20% of state home care positions are currently unable to be filled due to staffing shortages. According to a recent report from CUNY, the Fair Pay for Home Care Act would wipe out the home care workforce shortage in less than 5 years, keep older adults and people with disabilities safe and out of nursing homes, and bring approximately 200,000 new home care jobs into the field. We have come a long way in this fight for fair pay for home care in a very short amount of time. We have bipartisan support, majorities in both Senate and the Assembly, and Senate Majority Leader Andrew Stewart-Cousins has shown strong support throughout this campaign. Despite all this momentum and the dire need to have it, the governor did not include fair pay for home care in her executive budget earlier this year. Instead, she included one-time bonuses. This will not address or resolve the home care workforce shortage. We are now counting on our representatives in the State Assembly and Senate to bring fair pay for home care over the finish line. But we don't have much time. The state budget is finalized on April 1st. Your voices for fair pay for home care in this fight are more important than ever right now. If you are touched personally by this home care crisis, tell your story. Your story matters. If you know someone who is touched by this crisis, have them tell their story. Their story matters. We're collecting and publishing dozens of stories from the front lines of the home care crisis. You can share your story at a link in the chat that I will put in afterwards. And please utilize that link. Tell your story, tell someone to tell their story. It matters. No matter who you are, where you are, we need you to contact your representatives and tell them we need them to stand strong on fair pay for home care in this year's budget. Please take action at the link in the chat. And I'm going to put that link in there afterwards as well. Contact your state legislator. Thank you, everyone. I'm going to put my email in the chat as well. So if you have any questions whatsoever, you can reach out to me. And I'm also going to put a PSA in the chat so you can watch that as well. Everyone, it's time to make a change and let's put people over profit. Thank you very much.
Thank you so much, Gemma. And yes, please put those links in the chat. And so now we are about to have a break, an arts and culture break, led by Jamel of the New York State Poor People's Campaign Arts and Culture Team. The Arts and Culture Team is a critical part of the Poor People's Campaign because to build the type of just society we all deserve and we know is possible, we really need to reclaim and awaken our full creativity. And so we are so grateful for the gifts of the Arts and Culture Team. Jamel, are you here to unmute yourself?
I am, Ursula. Thank you so much for your emceeing, and thank you to all our testifiers for sharing and having the bravery to be in this space and to call us all in. I'd like to do my part and offer up a song that's a part of our movement. It comes to us from Sister Ana Hernandez. Song simply says, "There's a great trouble in the land. We're gonna set it right again. There's a great trouble in the land. We're gonna set it right again. There's a great trouble in the land. We're gonna set it right again. We're gonna set it right again. The trouble been brewing too many years. We're gonna set it right again. A trouble been brewing too many years. We're gonna set it right again. A trouble been brewing too many years. We're gonna set it right again. We're gonna set it right again. We're building a movement across the land. We're gonna set it right again. We're building a movement across the land. We're gonna set it right again. We're building a movement across the land, and we're gonna set it right again. We're gonna set it right again. We're learning who God made us to be. We're gonna set it right again. We're learning who God made us to be. We're gonna set it right again. We're learning who God made us to be. We're gonna set it right. Oh, 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 we're gonna set it right again. We're walking our feet on the path of love. We're gonna set it right again. We're walking our feet on the path of love. We're gonna set it right again. We're walking our feet on the path of love, and we're gonna set it right again. We're gonna set it right again. Oh, 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 we're gonna set it right again. Keep building a beloved community. We're gonna set it right again. Come on. Keep building a beloved community. We're gonna set it right again. Come on. Keep building a beloved community. We're gonna set it right again. We're gonna set it right again. Forward together, not one step
Not
back.
one step back.
Not one step back.
Wow. Thank you so much, Jamel. I don't know about you all, but I was here with my camera off, clapping and singing and really feeling that beautiful song, and looking forward to the day when we will be together and able to sing. We're going to go back to our hear from two final speakers before we wrap up the program tonight. And first, next, I would like to invite Dariela Rodriguez from Northwest Bronx Community Clergy Coalition to join us. Dariela, are you able to unmute yourself and turn on your camera?
Yes, I am here. Thank you. Thank you for having me. I'll get right to it. My name is Dariela Rodriguez. Good evening. I'm here today to share a story that unfortunately is probably a lot more common than it should be in our country and in our state. I am a mother who hasn't always been able to afford private insurance. I'm a mother who has been insured through work while I have to navigate the system of free or affordable health insurance to keep my children covered. And I have been a mother who doesn't always qualify or couldn't afford healthcare for myself. That means learning when the rules change in terms of renewal, fees, even qualifications. And it means sometimes having to pay, sometimes having free coverage, sometimes it's affordable, sometimes it's not. I've also struggled with figuring out how to get my children all the services they need while being fully covered, considering the limitations of the health insurance. But I always felt a sense of relief thinking that my children were covered in case of an emergency. And I wonder how many of you are parents who have felt the same way. Just like, at least I have this in case something really bad happens, at least we have this, right? Almost a year ago, my teenage son was complaining about feeling sick, and considering the pandemic, we wanted to avoid an unnecessary ER visit, and we took him to urgent care. In urgent care, we were told that it was probably just a stomach virus, nothing to worry about, and that he could be feeling those symptoms for several days. But after several days of symptoms for progressing instead of going away, we knew that it had to be something more serious, and we took him to the emergency room. By the time we returned to the emergency room from having an MRI, just that little short trip in the elevator, there were a team of doctors in the room waiting to inform us that his appendix had ruptured, and it was possible that it had been ruptured for days. He needed to be admitted to the hospital for immediate attention. We also needed to schedule a surgery for a month following him being sent home. My little 15-year-old baby, my 15-year-old, my first son. Unfortunately, that was not the end of the nightmare. I learned through my family's experience that I am also a mother of a child who required emergency medical attention, and that as that kind of mother, I found myself in a position where my child's insurance did not fully cover the enormous bill. There was a balance, and that balance would need to be paid by the parent. I was advised to get emergency Medicaid, which I did. And through finding out what options you have, you learn that there's no real support other than signing up for a payment plan. And people tell you, you can even pay $10 a month. Even in the hospital, they'll tell you this. They'll whisper it to you. You can even just pay $10 a month, sign up. What they don't tell you is how this debt is going to affect you and how long this debt will be there, because they don't tell you how much it's going to be yet, right? So before I share the number of this, the quantity of this bill that I received from the hospital, I want to share that I work full time. I work here, and in New York, my kids were born here. I was born here. We're in the Bronx. And I'm not saying that these reasons make us more worthy of health insurance or more worthy than anyone else. I'm mentioning these things because if I'm struggling to figure out this system and navigate it, I can't even imagine how other families in my community are also struggling. Who has the time to make all the many dozens of phone calls you now have to make and be on hold and figure out who can help you and what do you do next? I found myself having to decide there's no way I'm ever going to pay this. And I stuffed it in my junk drawer and I put it in the back of my head. I think I missed also that I was advised to apply for medical insurance through the state again, because there had previously been a rule for all the time that I guess this insurance has existed, where 3 months prior to your enrollment date, any medical debt that you had would be covered by, you could include it in your application. So I was advised to apply for new enrollment in health insurance. That didn't help me either, because that is no longer a rule, and that is not something that they do anymore. So now I had this in-between period and this debt. I shared my story in a conversation with friends at an event at Northwest Bronx Community and Clergy Coalition, where Roberta and her organizer ears overheard me. I think maybe she was surprised that me as an organizer wasn't making more noise about this situation. And she helped me realize that it's important to share the story. It's important to figure out what can be done, and that it is important not to allow the healthcare industry to be governed and decided on by profit-driven individuals. It reminded me that healthcare is something worth fighting for, and reminded me that we should all be fighting for healthcare for all, that we should be demanding forgiveness for medical debts. My son almost died. Before even getting the follow-up call, we received the bill. No mother, no parent, no human being should have to make a decision about whether they can afford to get the care they need, whether their coverage allows them to get the care they need, or whether financially they're in a position to get the care they need. Emergency Medicaid didn't cover the balance. State health insurance didn't cover the balance. And before I end my testimony, I want to share that I've been working really hard for many years to understand how to liberate myself financially. I studied the credit score hacks. I downloaded Credit Karma. I checked it regularly. I have tried to be cautious about my finances as a single mother of 2 sons. Despite all this, I am now currently in a debt so overwhelming, it wakes me up at night. I have reached out to all the numbers I've been given. I have had support from supervisors at the hospital. And currently, again, the payment plan is the only option. It would take the rest of my whole life to pay this debt. There is no liberation for anyone if one of the most basic human rights, healthcare, is not something we can all access and have. The amount or quality of healthcare we receive should not be based on how wealthy we are. These problems are systemic. They can be fixed. It is our responsibility to demand free healthcare for all. The balance was not covered by insurance or emergency Medicaid, and the balance is over $90,000. I still owe every single penny of it. So I'm sharing my story because I'm sure many people have found themselves with enormous, incredible debt that was a bill that was just sent to you. And yes, there might be options for ways to work around these bills, but ultimately the debt should be forgiven and everyone should have health insurance coverage. They should have coverage that actually provides the health care that they need. Thank you.
Thank you so much, Dariela, for sharing your powerful story. And we know that your story is the story of so many families who are slammed with medical bills, and no one deserves this. No one deserves to lose sleep over the burden of medical debt. Our last testifier is also from Northwest Bronx Community Clergy Coalition. And I'd like to welcome Dr. Iman Hassan to unmute yourself and turn on your video, and welcome.
Thank you. Hi, everyone. My name is Iman Hassan, and I'm a primary care doctor living and working in the Bronx. I'm here to testify about the state of our healthcare in 2022. I'm here to tell you all that our healthcare system today is broken and in dire need of repair. I watched on the front lines when 2 years ago, our healthcare system, already cracking, started to crumble under the weight of one of the most devastating pandemics in a century. Our outpatient clinics closed and our emergency rooms and hospitals were overwhelmed. It was during this time that I spoke with a patient over the phone who told me that her insurance just got cut off and she had no medications to treat her diabetes, hypertension, or other medical conditions, and she did not know what to do. Without medications, her diabetes was getting worse, and she was at risk for further complications like kidney disease, heart disease, and death. Imagine a society where in the middle of a pandemic, when our health is more crucial than ever, we allow our people to go without basic health care, without life-prolonging medications, and without access to medical services. We tried our best to help her that day over the phone, even looking for coupons online, but her story should not be the story of our healthcare system. There are so many other stories that should not be the stories of our healthcare system. One of my patients doesn't have a stable place to live. He has diabetes and he needs insulin, but he doesn't have health insurance. It costs hundreds of dollars a month to be able to afford insulin and essential sugar monitoring and testing supplies that are needed when you are on insulin. Knowing this, I tried all kinds of other cheaper medications, but they were not enough. And in the end, I had to tell him, look, you need insulin. There are times when he can get his medications and his sugar is great. And there are other times when he can't and his sugar is extremely high. A few months ago, he needed an amputation. That should not be the story of our healthcare system. Not too long ago, a person close to me was trying to get healthcare at a clinic and was told that clinic didn't accept his insurance. When we told them the name of the health insurance, the clinic representative asked, "Is that Medicaid? We don't take Medicaid," and hung up. Why should the type of health insurance dictate the kind of healthcare you receive or the kinds of healthcare institutions that you are invited into? There shouldn't be one healthcare system for the poor and one healthcare system for the rich. That should not be the story of our healthcare system. Someone recently reminded me that health is a birthright. To live a healthy life, to be free of illness and disease is a right. We are not born destined to have diabetes or heart disease at a young age, not because our parents had it or because our neighbors have it. And yet that is too often the story of our healthcare system. It's a story of a 33-year-old who had an entirely preventable stroke from untreated hypertension and was left struggling to relearn how to walk again. It's the story of a 55-year-old with diabetes who decided not to go to the doctor because a copay was too high and developed worsening kidney disease. In the Bronx, where we rank 62 out of 62 counties in New York in terms of health outcomes, these unfortunately are the stories I see too often. They should not be. Instead, the story of our healthcare system should be one where all people, no matter who they are, where they live, how much money they make, are entitled to healthcare as a right. The story of our healthcare system should be one where every individual has healthcare coverage and no individual has to fear losing that coverage. I believe that passing universal healthcare coverage can get us closer to the stories our healthcare system should be telling. I'm calling on our legislators to pass the New York Health Act.
Thank you, Iman, for your powerful testimony and for your commitment to the fight for healthcare for all. The stories that we've heard tonight speak for myself, have been gut-wrenching, and some of these things should not be happening in such a rich country, in such a rich state, and that's why we are fighting for systemic change with the Poor People's Campaign. So thank you all for being part of this fight. I am now going to pass the mic to my dear friend and sister and comrade, Pauline, with the Arts and Culture team.
Whew, thank you so much. These are some very, very powerful testimonies, and we're going to lift them up in song. And we're going to sing about how we shall not be moved. No nos moverán. We shall not be moved. Okay. So please sing along with me. No, 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 no nos moverán. No, 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 no nos moverán como un abro firme junto al río. No nos moverán. No nos moverán. We shall not be moved. We shall not be moved, just like a tree that's planted by the water. We shall not be moved. We shall not be moved. Unidos en la lucha, no nos moverán. Unidos en la lucha, no nos moverán como un abro firme junto al río. No nos moverán. No nos moverán. We're fighting for our rights and we shall not be moved. We're fighting for our rights and we shall not be moved, just like a tree that's planted by the water. We shall shall not be moved. Oh, we shall not be moved. We shall not be moved. No, 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 smoveran. No, 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 smoveran. Come no, bro. Firme juntar here. No, no, smoveran. No, no, smoveran. We shall not be moved. We shall not be moved, just like a tree that's planted by the water. We shall not be moved. We shall not be moved. We shall not be moved. No, no, we shall not be moved. No, 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 smotheran. No, 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 smotheran. Come una bro. Firme junterio. No, no, smotheran. We shall not be moved. We shall not be moved. That's right. It's 4 together. I'm going to swing back around here. Thank you so much for singing with me. So it is my deep honor to introduce the next 2 panelists and speakers that we have. First, we have Nijmi Zakia Zarenko, who is a working class Black, Indigenous, and queer organizer and strategist for over 20 years from Pennsylvania. She is a co-founder and volunteer route coordinator of Put People First PA, a statewide base-building human rights organization waging a healthcare as a human right campaign. They are also a tri-chair of the Pennsylvania Poor People's Campaign and a member of the National Steering Committee. Nijmi is also an organizer with the PA Homeless Union and a member of the University of the Poor and the Popular Education Project. It's an honor to have you with us. And also Sheila Garland Olarian, who grew up in Flint, Michigan. As a child, she walked the picket lines with her father, who was a member of the United Auto Workers Union for 35 years. Sheila has organized across the country, most recently with the National Nurses United, organizing registered nurses into the union from Nevada to Florida. She is currently a member of the Illinois Coordinating Committee for the Poor People's Campaign, a national call for more revival. She has been a board member of the National Welfare Rights Union. She has also, for years, been involved in leading the fight for a healthcare system for all in Illinois and across the country. She is active in the fight for environmental justice, which is inextricably tied to the demand for healthcare for all. She is a member and activist in the Chicago South Side Coalition to Ban Peacock, and is a board member of the Southeast Environmental Task Force. Sheila helped form and sits on the board of Reclaim Chicago, an IPO of National Nurses United and the People's Lobby. She's lived in Chicago for the past 20 years. So we are very grateful that you are both with us so we can learn from your struggles and strategies. And thank you so much for being here. I will pass it over to you all. Go for it, Nijmi.
Okay, thank you so much, Pauline, for that introduction. Sheila, you're welcome to go first. I thought you were maybe, but
yeah,
I just want to offer a few.
Well, if you don't have an issue, because it would be great. Hi, everybody.
Please go first. Yeah.
Do you mind, Nijmi?
Please.
Oh, okay. Well, thank you so much.
Not at all. I want you to go first, Sheila. Please. Thank you.
Anyway, thank you so much, Pauline, for that introduction, and really just an honor to have been a part of listening to the testimonies of people who are, really impacted deeply by the barbarity of our healthcare system. I, I struggle and I tend to speak rather extemporaneously, which can be problematic, but I always speak politically and really try to understand why we are where we are, what has preceded us, and what has failed, what has succeeded, and why. Because I think the deeper we dig into and understand the trajectory of this fight that we're in, it really helps us to hone not only our strategies and understand who and why we have allies, some that are permanent, some that are temporary, and what kind of compromises have been made, and make the decision about whether we are going to compromise, continue to compromise, and if there are any further compromises to be had. So I just want to, and in my introduction, I should add that I'm part of the University of the Poor as well. I am a part of the University of the Poor Journal, and we have a University of the Poor Chicago chapter here that I'm active with. So, and I'm retired. I'm no longer working with the nurses. I retired 3 years ago almost now. So, so I have a lot of time to do what I want to do that I no longer work. So I just wanted to kind of situate where the United States has stood with respect to healthcare and how it's been viewed, because it really informs what we do today and the successes and the failures that have happened. I'm going to make this brief. So, the fight for health care, health insurance dates back to the end of slavery. I don't know if folks know, but during the period of Reconstruction, over 400 hospitals were built in the South. After slavery was ended, Black people participated in figuring out what kind of future they were going to have. And part of that included access to healthcare. So not only did you have the 4 million folks that had been held in slavery being able to have some sort of access to care, and who fought deeply in the Civil War, lost lives. We know the history, but 5 million whites also benefited from that tremendous shift at the base of society, where there was the ability to reconstruct our country, ideally at that time along a democratic basis. We know that Black Reconstruction was brutally overthrown, and we've experienced a period of Jim Crow and segregation on par with what we know about other countries in this world, South Africa, Israel. And so we have been, on this fight to gain the dignity that we need in order to have health and to, live out what the Constitution was allegedly to guarantee us. But anyway, let's kind of look into, because most of the demands around healthcare over the past 100 years or so have really been around the needs of capital, and also around the need for certain sections of capital to align with certain sections of the poor and the dispossessed in order to meet their goal. And so we know that starting at the end of the 1800s, and even before, but I'll just use that as a nodal point, there have been movements to liberate workers, for workers to take control of their countries. Most notably, we have the experience of the Soviet Union. The first time, the history of private property, where the workers and the peasants rose up and took control of their own government. And this was, absolutely outside of what capitalist democracy had in mind. So yes, free Palestine. And so that's where we began to see this whole idea around red baiting in the United States, because every move from certain sections of society to legislate or to come up with some sort of a policy to shift how healthcare was delivered and the forms that it would take have been met with red baiting. that we're going to turn the United States into a socialist, a Soviet. They would lift quotes from Lenin that said the access of health is the first step you need toward liberating humanity. All these things to really terrify people into this idea that if health is supplied for all workers, then somehow you're on the path to socialism. And this has been a very effective tool throughout the past century in terms of how we've been able to fight for healthcare. Most of those fights, and there are a lot of references, and I'm just going to give you a very brief introduction. Most of those fights for health insurance or some form of healthcare have been fought from the upper echelons of society and have been tied to policy legislation. And so it made it very probably a little easier to derail, to end, to forestall, to crush those efforts. Why? Because it's not the very bottom of society that's rising up and making the demand for a change in a policy or a change in the way the country operates. And so they were derailed. There have been times when you've had progressive presidents, for example, Truman, who was the first president to actually introduce legislation for some sort of universal health care. But it was met again with, the cries of this is socialism, just red baiting, and it never made it to a hearing. But moving into and after the Korean War, there rose up among seniors in particular, a demand for some sort of an assurance that they would have access to healthcare in their old age. And so what started out as kind of a legislative fight coming out of the Truman administration, you had seniors, grassroots poor, who rose up and demanded some form of healthcare. And that was how we got Medicaid and Medicare. It was signed into law under the Johnson administration. So it took a long time for that to get passed, but nevertheless, it had been a demand that came from the root of base of society by a group of people who needed it, which are poor seniors. And that's how we ended up with Medicare and Medicaid. But I do want to, talk a little bit about what we've seen over the past 40, 50 years. I think people understand that the fight for healthcare was not won by the unions, because when unions were in their heyday, one of the things that happened that made it really challenging to bargain or negotiate on behalf of the entirety of the working class was the fact that it was mostly the industrial workers who were corralled into the unions, or who were able to participate in the unions, and all the other workers, agriculture workers and et cetera, were corralled out. And in Europe, for example, labor and socialist parties had a little more power. And so they were able to negotiate and to fight for some form of what we see as national health insurance, or some form of public-private delivery of healthcare, which, by the way, all of those systems are under attack by big capital. I always tell people I grew up in Flint, Michigan. And I say that because, Flint was one of those places where you had a very, we had over 100,000 people engaged in auto production in Flint, Michigan at one point. And I remember when they brought the first robotic arm into the Buick plant. That robotic arm immediately displaced 400 workers. Those 400 workers hit the door. They never came back again. Today, there are less than 10,000 people engaged in auto production, but yet not one single automobile less is being created. So that means that now you have a tool of production that has absolutely and utterly altered the way that money and profit can be made, but that is making workers obsolete in many areas. I mean, I think people remember when you would go into the bank and there'd be a line of tellers and accounting departments and hundreds of thousands of people involved in financing and banking. That's gone. Most of that stuff is done electronically. The steel industry, a lot of mining, a lot of these industries and services that were very much powered by workers are changing. So what does that mean? if you have a technology that permanently replaces workers, that means that now the system has to find new ways to realize profit. And one of the ways that it has made tremendous profit is through the healthcare insurance industry. Let's face it, everyone needs healthcare at some point in their lives. And what better way than the commodification of healthcare than to guarantee that the healthcare industry remains flush, where you can pay $14, $20 million for a CEO of a hospital chain or in the healthcare industry. But we hear stories like we're hearing today where people cannot access care. So we're talking about rationing, we're talking about denial, we're talking about the privatization of the public aspects of healthcare that we've been able to win in Medicaid as well as in Medicare. I'm on Medicare, only 80% of my Medicare is covered. I have to pay for the other 20% by buying some sort of insurance instrument. And I also have to buy my own pharmaceutical plan. So the Medicare that we have now doesn't really cover what we need. And so the fight for healthcare has been, really sort of populated by doctors and nurses who have led the fight because they see, the impacts of not being able to provide the care that they need for their patients and that sort of thing. The problem with the professionalization of organizing for healthcare is that it leaves out the patient. The patient only becomes a bit of a token where you can come in and give your testimony, but you don't have the power in that dynamic to really fight for what we need. And so these kind of efforts that we're seeing here on this call in Pennsylvania, Nonviolent Medicaid Army of the Poor, and those kind of formations among folks at the very bottom of society is the way that we're going to, push this demand for healthcare for all. Rightfully so, during the emergence of the first Poor People's Campaign, Dr. Martin Luther King and others, said, listen, healthcare is a human right. The right to an income, a guaranteed income, is a human right. The right to live in peace without war, is clearly a human right, and putting it on the level of a human right opens the door to do the kind of organizing that we see getting pulling together today. I think just what's happening currently, I think all eyes are on California. I just want to switch over to that. Again, we have a legislative fight for some sort of a state Medicare for all, expanded version of Medicare for all. We know that the governor who initially ran supporting healthcare for all is no longer willing to do that. And so he's willing to put forth some sort of a compromise legislation that would include an expansion of healthcare in California to undocumented folk, which is the right thing to do. But the best way to guarantee that everyone gets healthcare is to, get on the path of some sort of Medicare healthcare for all that would take the private and public hospitals that currently exist and, pull those together with one payee, that being the government. I don't know exactly how it's going to happen because the way the law is written federally means that the states that run a single payer program have to get certain waivers and all sorts of things in place in order for a single payer system to be put into place. So we'll wait and see. But I think people are getting politicized every time they enter into the fight, and how the fight digs down into the community will begin to make a difference as we move on into this, into where we are right now. I don't think, quite frankly, that we will get any kind of significant reform in healthcare unless the very bottom of society is organized to fight for it. And the thing that makes it, I think, even more dangerous and challenging for our ruling class is that it has the potential to unite on such a broad basis that they're going to have to find every single arsenal and weapon to guarantee that it fails, so that it continue to be a profit center. Now, how that plays out, I mean, I don't have a crystal ball, and there might be some concessions because right now we know that the economy and the political situation is at a precarious stage, and they have to figure out how we're going to continue to maintain control. And so maybe some sort of concessions around healthcare may be in the offing. I don't know, but we can look at history and see how our fights, if it's not centered in the section of society that needs it, it is always up for some sort of derailing, some sort of, putting it in a path that is not going to get us anywhere close to where we need to go. There are a lot of things that I want to say that, sort of come up in this discussion. The closure of hospitals, Vernetta was talking about what's happening in Mount Vernon. Take this and replicate this across the country in rural, in urban, poor whites, Latino, I mean, everywhere that they can consolidate and realize more profit. This is where they're going to go. Health care is exchanged on the stock market. So that gives you an idea of how important the dollars around healthcare are to this entire economic system. And so to unravel any piece of that, we have to really work from and unite from the bottom of society for those folks who have nothing to lose but our chains in order to get the healthcare that we need. I know there's some things that I left out. But I do want to say that we should keep our eyes on California and really see where this fight will take us. I know some of the inside, having worked with the nurses union in California, what some of the methods are in order to get this, to win this fight. But we should definitely keep our eyes on that. And if there are ways to support that effort, we should certainly do so. But at the same time, we cannot lose sight of where we are here today on this call and the people that we're organizing among in order to guarantee that we have some sort of healthcare delivery system in this system that is humane. So that's kind of all I want to say for today. I'm going to hang on for Nijmi, and thank you for giving me this opportunity to speak.
Awesome. Thank you so much, Sheila. I know time is of the essence, so I guess I'll just jump in. I so appreciated what you just said, and I really am honored to be here and want to just really thank the New York State Poor People's Campaign, the Campaign for New York Health, the Labor Religion Coalition, all of the organizations here, and all of the speakers who were extremely powerful. I'm going to share my screen and just share a little bit with you here, building on everything that's been said and also particularly the analysis that that Sheila just shared with us. So as I get that together, just gonna try to get on video as well. Okay, I think I am. Great. All right. So what I want to talk about tonight is exactly what Sheila just raised and what I know is on a lot of our minds, organizing the 140 million as a mass independent political force, using healthcare as a rallying point for the working class. We are objectively united by the situation that we face as a class with regard to the healthcare system. We're objectively united, but that doesn't mean that we're all aware of it. And so we have to do the work to raise the consciousness and to organize, to build that unity that is at hand through our common experience. I want to pose this question. I think we know the answer, but I think it's worth asking, and even asking in our base building conversations. Do working class people have the same interest in the healthcare system as the wealthy? And here's one answer, right? Talking about initial public offerings, and I have to give thanks to Avery Book of the Vermont Workers Center, who put together some of this information that I'm using tonight, and who is also part of the Nonviolent Medicaid Army. Initial public offerings have exploded since the onset of the pandemic. Investors poured $30 billion into 130 healthcare deals in 2020 and $21 billion across 130 deals through the third quarter of 2021. Private equity has invested $237 billion in healthcare in the last 10 years. I'm not going to read everything here because I know we're very pressed for time, and I don't want to also have to put undue stress on our translators. So I'm just going to read some highlights, and I'll be happy to share this with people afterward. So I think that's our answer to this question, right? That the wealthy and the ruling class do not have the same interest in the healthcare system as we do. Every single person who spoke tonight talked about the fact that we need healthcare. We need it to live. We need it to survive. It is a basic right. We need it for our children, for our families. That is not the same interest that is being expressed by $237 billion in private equity being invested solely for the purpose of creating more profit for the wealthiest people in society. So we actually have a fundamentally different interest in healthcare between the working class and the ruling class, and I think that's very important to understand. And in the midst of that, we have the bipartisan organized abandonment of the 140 million. This slide just shows that healthcare, universal healthcare, is an extremely popular issue, right, with voters. This is AOC saying that every single swing seat House Democrat who endorsed Medicare for All won re-election. So politicians are using this to win elections. But when they get into office, they are not delivering, right? Because in reality, the ruling class, the state is an apparatus that works on their behalf, essentially. So they're using healthcare to get into office. We're voting for them to make healthcare a right and not a privilege. But when they get into office, they're not working on behalf of our interests. So I want to talk about this question of organizing of an independent political force, the nonviolent Medicaid army, what Sheila just talked about in terms of we need a mass social movement. And the right to healthcare and the fight for healthcare is a poor people's campaign. But we know that poor and dispossessed people, the 140 million, are the most disunited, disorganized section of society. But there are over 76 million people enrolled in Medicaid. This isn't counting the people who are unfairly excluded from Medicaid due to a lack of Medicaid expansion, documentation status, or other reasons. So over 50% of the poor and dispossessed people in the US are Medicaid recipients, and nearly all could be considered part of the nonviolent Medicaid army. What if we could organize that group of people into a powerful, independent political force? So I'm using this term, the nonviolent Medicaid army, and I want to just say what it is. It's a growing militant force of the poor and dispossessed, modeled after King's Nonviolent Army of the Poor from the first Poor People's Campaign of 1968. Those who are on or excluded from Medicaid represent the diversity of the entire working class and are impacted by every single front of struggle there is, be it housing, education, mass incarceration, immigration. The fight for Medicaid unites the North and the South of the US, and the fight for healthcare unites the global working class. The nonviolent Medicaid army centers the leading social force, the poor and dispossessed, in the fight for healthcare as a human right. History provides us with powerful lessons about the ability of healthcare to be a rallying point and a galvanizing issue for the poor and dispossessed. We have Black Panther Party free health clinics, the Young Lords takeover of Lincoln Hospital, the community health movement in Kentucky and Appalachia as just 3 examples. So the nonviolent Medicaid army is taking up this charge within the Poor People's Campaign, a national call for moral revival. I know someone put it in the chat before, but you can find out more at nonviolentmedicaidarmy.org. We have many, many states that are thinking about and using and trying to organize, using healthcare as a lens to expose the entire system, to understand more about how the entire system works, and to organize the poor and dispossessed, that 76 million and more who are on Medicaid or excluded from Medicaid. And so I know that we're all going to be organizing and mobilizing toward June 18th, 2022. The denial of healthcare is immoral, and healthcare can be, once again, a rallying point, a very powerful way to build unity and to bring unity across lines of division, which we so desperately need in order to make a fundamental change in how our system works. So I just, once again, really want to appreciate being here with you all. And thank you so much for having me tonight.
Fantastic. Thank you so much, Nijmi and Sheila. And thank you to all of our testifiers, all of our speakers. Incredibly powerful testimony, incredibly powerful stories of struggle and resistance, and really critical context, Sheila and Nijmi especially, about what we're up against, what this fight is going to take. I'm about to talk through a few different calls to action and things that we're going to do, because I don't know about you, I heard some of those testimonies. I get pissed. I gotta do something about this, right? We got to get involved. And I know many of you are probably already involved in some organization, possibly multiple organizations. If you're like me, or maybe you just know a lot of folks. We sometimes get in these little activist bubbles, and we got 15 different membership affiliations cards in our wallet or whatever. But really, the reality is we know that most people are not actually organized in any way. So many people in our state are not organized, even though they're suffering under healthcare crises in many ways, similar to our testifiers shared in ways that we haven't heard in all sorts of other stories. And so our task, no matter how we want to engage in that, is to organize people into this movement to fight for healthcare as a human right. So I would encourage you, and we're going to share a few different links. Paige is going to put a link tree so that you can follow up. If you're not already connected, oh, that's actually the wrong one, Paige. That's the New York State Poor People's Campaign link tree, which is a good one. But we actually have a labor religion link tree, which I think I shared with you earlier, if you can throw that in. And that has links to connect with all of these organizations and all of these campaigns, whichever your particular entry point into this movement. We're not throwing egos around here and saying that one group's better than another. We know that we need to work together and unite across these lines of division, and that includes our organizations and our movements. But we are in the midst of a struggle right here in New York State as well, that so many folks heard about. You heard about a few of the different legislative pieces, and one that sort of came up and sort of lurking in the background is this bottom one here, the New York Health Act. But I want to talk briefly about some of these others. These are key steps towards universal healthcare in our state. And so we heard from folks talking about coverage for all, which would expand access to healthcare for immigrants in our state. We heard about fair pay for home care. We know that it is poor and working class people who are suffering under this system, poor and working class people who are providing the services, right? The healthcare services that many of us, when we can access, we receive and benefit from, but also the people who need those services the most. The Scrap the Cap is about the Medicaid cap. This kind of absurd thing I won't get into too deeply, but there's a lifetime Medicaid cap. If you need long-term healthcare services through Medicaid, at some point they're just going to cut you off. And then ending medical debt, ending these predatory medical billing practices and providing immediate relief. And the key of these four pieces is that they are steps. They are important steps. We need to struggle and fight and claw every inch to get back what the ruling class has stolen from us. My previous slide, I forgot to mention, this is a slogan from the Welfare Rights Union and the National Union of Homeless. We only get what we're organized to take, right? The ruling class doesn't want us to have any of this stuff. If it were up to them, they'd barely throw us the crumbs to keep us working. And so we got to fight for all of this. And the New York Health Act is sort of our North Star in New York, right? We have to fight for all of these pieces as we build this unified movement led by those most directly impacted, the poor and dispossessed, to fight for healthcare as a human right for all. And as Sheila pointed out, people are going to throw all sorts of things at us. You know, there's a long history of this red baiting. People are going to throw slurs at us. People are going to, argue if they're in a position where they've got pretty decent health insurance, maybe they think they're doing okay. We got to confront that. We got to challenge that. We got to organize a movement so that everyone understands that we're all in this. And the only people who are really going to suffer further if we expand healthcare to be a human right is the ruling class, right? The ones who benefit from the system as it is now. And so we need to unite all the folks who are struggling under this present system. So a couple specific actions you're able to take. We are in the midst of a New York State legislative session. And that means there's a lot we can do right now. Our opponents on this have taken a few different tactics. A couple years ago, and even up to last year's legislative session, despite the fact that we've got super majorities that ostensibly would support something like this, that have co-sponsored the New York Health Act, they basically took the tactic of, we're just not going to say anything about it. We're just not going to bring it up and hope it goes away. We've got a few healthcare champions in the legislature that made sure, at least at the end of last session, that wasn't the case. There was a pretty remarkable moment on the floor where one legislator was going through every single bill that was being passed at the end of the session, or every crisis that was ongoing, and pointing out how the New York Health Act would alleviate the different problems. It was a pretty remarkable moment. But this is what we're up against. We're up against even the folks, as Nijmi pointed out, folks who ran on this, folks who said, this is what I'm going to do when you put me into office, right? And then they just clam up. They don't have anything to say about it anymore. Suddenly, the forces of the ruling class, the forces who do benefit from the current system or think they benefit from the current system, have been playing the back room deals, and so we don't get to hear that. We need to make our voices heard, though, and there's a few ways that we can do that. Next week, our partners, the Campaign for New York Health, Make the Road New York, and others in the Coverage for All Coalition are mobilizing, getting on the bus to Albany. You can go to that labor religion link tree and join in on that if that's something you'd be available to do, to join us on Wednesday, March 2nd for a day of action in Albany. And like I was just saying, because a lot of our legislators and lawmakers just want to act like they're not hearing this, or they don't want to say anything about this, we need to make sure that they hear us and all of the people that we're organizing around this. So you can take action. Their phones, their emails, their Twitter pages should be ringing off the hook. We are still in a pandemic, y'all. Let's make sure that these folks know we're not going away, that we're not going to be, just forced. They can't just end some mask mandates and force us back to work without actually providing the human right to healthcare that we know we need. And maybe you were listening in today, or maybe someone, you heard incredibly powerful testimonies. And part of our tactic in the Campaign for New York Health is to cultivate and develop and share these stories. And so we got a whole process for that. You can go to that website, also contained in the link tree, to share your story and really take this pain and suffering that we're dealing with and turn it into a weapon to go after the ruling class, to go after the vampire of this for-profit healthcare system that is benefiting from our suffering. There are other ways that we're going to organize to unite across these lines of division to build this poor people's movement. I want to save the date. You can't register for this one just yet because we're working out a few different details. But the Poor People's Campaign and National Call for Moral Revival is holding these mass assembly events around the country in the lead up to June 18th. And one of them, coming up on April 11th, will be in New York City. And so we know many of our folks from Hudson Valley and the Bronx and Long Island especially are particularly proximate to that. So we want you to save the date. A group of us recently was doing a study of King's Martin Luther King's book on the Montgomery bus boycott. And every week for a year, they had mass meetings in Montgomery. And those events served as this powerful centering point to continue to build and strengthen the unity of that movement, to reinforce the clarity of why people were struggling, why people were continuing to walk and maintain all of the different driving arrangements that they had to keep that movement going. If you've never been to a mass assembly like this, this is not the kind of thing you're going to want to miss. They're powerful, and we're not even proposing that we start doing these on a weekly basis, but it's an incredibly important opportunity for us to join together to unite our disparate struggles into one unified movement. And then all of these tour stops are pointing to this thing that Nijmi mentioned as well, and that is June 18th. And you can actually mark down and sign up for this now. More info on buses will be coming. But we're calling for a mass poor people's and low wage workers assembly and moral march on Washington. We know that the struggle for healthcare is connected to the struggle for housing. It is connected to the struggle for a clean environment. It is connected to the struggle against police violence and against prisons, right? It's connected to so many things, against ongoing US imperialism and warmongering that we've been witnessing in the news for as they've been pounding the drums for the past few weeks. This task of uniting the poor and dispossessed is our most urgent task. And so every tactic needs to be on the table, whatever we can do. Nijmi didn't say this today, but it's something that I have said before, so I'm quoting her. Every day that we're not working to unite the poor and dispossessed across these lines of division, we are losing ground. It is our central, most critical task. And this action in DC is one critical moment to raise with one voice the power of the over 140 million poor and dispossessed people who are struggling for the right to health, the right to a clean and safe environment, the right to safe housing, right? The right to an education. These are not things, sometimes the word entitlement gets thrown around. No, poor and dispossessed people have a right to these things, and we got to fight for it because the ruling class doesn't want us to have those things. That's it for me. I'm going to pass it over and close up. I know we're right at about 8:30. Thank you so much for hanging with us. Molly Dowell-Baum, a comrade in the Capital Region Poor People's Campaign, is going to close us out with a song. Folks, you will get all of these slides. You will get a copy of this recording, and you will get these calls to action. I want to thank all of our organizing partners who have been helping us plan and get the word out about this event in particular. Thank you again to all of our testifiers and our keynote speakers. Forward together, everybody, not one step back. Molly,
not one step back. I need my video on. Please. All right, well, we're gonna sing The Rich Man's House, and I have my two lovely assistants here, my two daughters.
Can somebody?
It's still not saying, it's still saying I can't do my video. So if somebody wants to help me.
Oh.
With that. Okay, there we go. Oh, there we go. Yes. Hello. All right. So we're gonna do Rich Man's House. So this is a song. Watch out. Good grief. This is a song that's by Minka Wilkes and the Economic Human Rights Choir of the New Freedom Bus. And we're gonna sing this song this winter, this spring, this summer when we go to DC. We hope that you'll go to DC because this crew is going to DC. So they're gonna sing along with me. The lyrics are gonna be dropped in the chat. So we're gonna say, went down to the rich man's house and I took back what he stole from me. Took back my dignity. Took back my humanity. Oh, I went down to the rich man's house and I took back what he stole from me. Took back my dignity. Took back my humanity. And now it's under my feet. Under my feet. Under my feet. Under my feet. Ain't gonna let no system walk all over me. No system. Let's go to the governor's house. Went down to the governor's house and I took back what they stole from me. Took back my dignity. Took back my humanity. Went down to the governor's house and I took back what they stole from me. Took back my dignity. Took back my humanity. And now it's under my feet, under my feet, under my feet, under my feet. Ain't gonna let no system walk all over me. Go to the White House, June 18th. Went down to the White House and I took back what they stole from me. Took back my dignity. Took back my humanity. Oh, we went down to the White House and I took back what they stole from me. Took back my dignity. Took back my humanity. And now it's under my feet. Under my feet, under my feet, under my feet. Ain't gonna let no system walk all over me. No system, no, no, no. Ain't gonna let no system walk all over me. No, one more time. Ain't gonna let no system walk all over me. Forward together.
Okay, now we can watch those words.
No, one step
Thank you,
back.
everybody.
Good night, everyone.